Hi, I'm Dr. Sara Baird. I'm a physical medicine and rehabilitation physician for Steadman Hawkins Clinic of the Carolinas and Greenville Hospital System. I will be performing your epidural steroid injection today. This procedure involves guiding a needle into the epidural space in your back. My particular approach is called a transforaminal approach, where I go in through the side. It's called the foramen at the particular level where you are having symptoms. Prior to the procedure, I will need to let you know about the risk of an epidural. Anytime we do an injection, there's always a risk of bleeding. I ask that you stop all blood thinners prior to the procedure to minimize that risk. There's a risk of infection. We use sterile technique to minimize that risk. There's a risk of nerve or soft tissue damage. We use X-ray guidance to minimize that risk and make sure that we're avoiding the neuro and the vascular structures. And there's a risk that it won't help you. Either myself or another physician has recommended this because they do feel that you will benefit from this procedure. Please let us know if you are currently on any blood thinners, including Coumadin, aspirin, Plavix, Lovenox, or any anti-inflammatories like ibuprofen or Aleve. Let us know if you're a diabetic, because it can increase your blood sugar, and this will need to be monitored closely over the next several days. Please let us know if you have any allergies to seafood, iodine, or contrast, as we will be using these in the procedure. And let us know if you've had a recent fever or chills or current infection requiring antibiotics. The procedure performed today will take approximately 10 to 15 minutes. We will take you to our fluoroscopy suite where our X-ray machine is, and you will be laying on your belly on the procedure table. We will then clean off your back very well with iodine, and we will then take some pictures of your low back to further identify the anatomy of your lumbosacral spine. We will give you numbing medication, which will feel like a bee sting, a stick and a burn, and oftentimes patients say that this is the worst part. After that, we will use X-ray guidance in order to direct the needle into the epidural space, as I previously described. Once the needle is in the epidural space, we will administer contrast solution, which will confirm correct needle placement. We will then give you the medication, which includes steroid and numbing medication. The procedure will then be complete. The numbing medication will work almost instantaneously, so you may feel great relief for the next 3 to 4 hours after the procedure. I ask that you rest today. You may have some muscle soreness, so you can use ice on your back for 15 to 20 minutes at a time every 3 to 4 hours. Starting tomorrow, you can resume normal activity. The steroid can take up to 2 weeks to work. Patients will often say that they feel slightly worse several days after the procedure, but by 7 to 10 days you should start feeling some relief from the steroid. You will follow up with myself or your referring physician approximately 2 weeks after this procedure is performed for reevaluation. Please let me know if you have any questions or concerns either before or during the procedure. If you should develop any fever or chills, sudden weakness or numbness in your limb after the procedure, please contact the clinic immediately and seek medical attention. I don't anticipate that you will have any complications from this procedure, and I'm hopeful that you will reap good benefits as far as your low back pain and your leg pain is concerned.